And we're back for renal anatomy. All right, I'm excited. Hope you are too. Okay, so for our kidney models, you're going to see a bunch of different kidneys. Some look like this. We have a tiny little popsicle kidney. What's cool about this is it has the adrenal gland on it. We also have these, and there's one that has a gray background, like you can see. There's one back here that has a green background. Okay, look at both. Again, they have the same structures, but they might just look a little bit different. So you could see either on your practical exam, so look at both. I'm going to focus, I think, more on the gray background just because. If we look at the kidney as a whole, okay, we can obviously see the kidney. We're going to start here. On top of the kidney would be the adrenal gland. The adrenal cortex is the outer part. Adrenal medulla is the inner part. We'll get to that in the endocrine chapter. The kidney itself. So we have two regions. The outer region, this outer rim between my fingers, is called the renal cortex. We should know by now that cortex means outer. In the brain, back in A&P1, can't forget about A&P1, we had the cerebral cortex. And just like this, it meant outer rim. So in this case, between my fingers is the renal cortex, and that's where all of our nephrons are. This is an up-close look at the nephrons up here, and then here we can see an up-close look at the glomerulus. But from here, renal cortex is this outer region, which means that the inner region between my fingers is the renal medulla. Renal cortex, outermost, innermost is renal medulla. This is going to be the ureter. Okay, once we form urine, it's going to leave the kidney, go to the bladder via the ureter. And then we have a pathway for that urine. Minor calyx, major calyx, renal pelvis, and ureter. I said that in that order because that's the order. Once the nephrons do their thing and filter the blood and form urine, that urine is going to travel down, and it's in that order. So the passage for urine out of the kidney, minor calyx, major calyx, renal pelvis, ureter. All right? If we look at the renal medulla, that's this inner part here, the primary feature of the renal medulla would be the renal pyramids. This is a renal pyramid, renal pyramid, renal pyramid, renal pyramid, renal pyramid. Between each renal pyramid is an area called a renal column. So renal pyramid, renal column. Every renal pyramid has a little point to it, and that point is called the renal papilla. Think about P for point. So each renal pyramid has a point called a renal papilla. Okay? Other things to point out. The entry point. So literally, the little opening where the ureter comes into the kidney, that opening in the kidney, opening right here, that opening is called the hilum. We saw it in the lung where the bronchi and the pulmonary vessels enter the lung. That means the same thing here. So the little opening in the kidney where the ureter comes in, and by the way, the renal artery and vein, that opening in the kidney is called the hilum. Okay. Renal cortex, renal medulla, renal pyramids. The point of each pyramid is the renal papilla, renal cortex. Then we have the pathway for urine to go down to the bladder. So we have minor calyx, major calyx, renal pelvis, ureter. Obviously, renal artery is red, renal vein is blue. Okay. Let's look at the nephron. The nephron itself, we can see its parts are in white here. So if we were to focus in on the renal cortex, inside the renal cortex are just millions of smushed together nephrons. And of course, the function of the nephron is to filter the urine and filter the blood and produce urine. We already know from lecture the parts of the nephron. So we first start with the glomerulus, that little ball is the glomerulus. Coming off the glomerulus is the proximal convoluted tubule, loop of Henle, distal convoluted tubule, and every distal convoluted tubule empties into the collecting duct. And by the way, the collecting duct is going to go into the minor calyx, major calyx, renal pelvis, and ureter to go to the bladder. We pee it out. So the major parts again: glomerulus, proximal convoluted tubule, loop of Henle, distal convoluted tubule, collecting duct. Getting more specific, the loop of Henle, we have a descending limb and then an ascending limb, because that's the direction that the blood's going to flow as the filtrate's getting filtered. Filtrate. Because the proximal convoluted tubule leads into the loop of Henle, this is the descending limb, comes around, ascending limb. You'll also notice there's thicker segments and thinner segments. Okay? Let's move on to the glomerulus. So this is an up-close look at this. Okay? If we were to look at this as a whole, we would say that, hold on, I'm just thinking for a minute. Nephron. This whole thing is the renal corpuscle, all right? So the renal corpuscle is this whole thing. The renal corpuscle includes the glomerulus. The glomerulus is actually the ball of capillaries. The renal corpuscle includes the renal capsule, which encapsulates the capillaries. And of course, there's a capsular space in between the renal capsule and the glomerulus. By the way, the renal capsule is also called Bowman's capsule. Okay. I'm going to go back, kind of skipping around, but you're studying, so you're with me. If you look at the nephrons, there's two different types, and these models show you both. The most common type of nephron is called a cortical nephron, and a cortical nephron, more of it is in the cortex. Between my fingers is the cortex, down here is the medulla, the renal medulla. Even though some of the loop of Henle goes down into the medulla, there's a lot in the cortex. So that's a cortical nephron. On the other hand, we have a juxtamedullary nephron. So notice, in the juxtamedullary nephron, a larger portion of the loop of Henle goes into the renal medulla. And that's why it's named juxtamedullary nephron, because more of the nephron goes into the medulla. All right. Let's talk about the blood vessels. If you look at the blood vessels, let's start here with the big overall picture of the kidney. We obviously have the renal artery, and you're going to need to memorize the path as these arteries get smaller and smaller, and then the path of the veins coming back out. So we're going to start in order with the renal artery. The renal artery comes in, and it splits off immediately into segmental arteries. The segmental arteries split off into interlobar arteries. They're between the lobes, in this case between the renal pyramids. So we have renal artery, segmental arteries, interlobar arteries. Then the interlobar split off into arcuate arteries. The arcuate, I think about an arc because it kind of forms an arc shape over the bottom of the pyramid, arcuate arteries. Coming off of the arcuate arteries are the interlobular arteries that come up into the renal cortex, interlobular. Be careful, we had an interlobar, which was down here, and an interlobular. The fact that the suffix is lobular tells us that they're smaller. So let's review. Renal artery brings in blood supply to the kidney, splits off into segmental arteries, interlobar artery, arcuate artery, interlobular artery. The veins are almost named the same, except the only difference is there's no segmental. We don't have as much blood coming back, so we don't need that extra branch. So if we work our way backwards, what's going to be coming back through the venous circulation? Interlobular vein, blue, arcuate vein, interlobar vein, but because there's no segmental, the interlobar vein goes right to the renal vein. Let's do the veins again. Interlobular vein, arcuate vein, interlobar vein, straight to the renal vein. Now, if we were to get really up close, coming off, let me just see myself a little better there, sorry. Coming off of the interlobular artery, that's where we get to the afferent and efferent arteriole. So you can't see it here because it's microscopic. But if we look here, we can. This is an up-close look at one of the pyramids coming up into the renal cortex. So I can see this would be the interlobar artery, this would be the arcuate artery, and this would be the interlobular artery. Well, guess what? Coming off of the interlobular artery, the vessels that feed the glomerulus is the afferent. Afferent enters, goes into. So coming off of the interlobular artery is the afferent arteriole, which feeds the glomerulus. We're going to see a blood vessel leaving the glomerulus. That's the efferent arteriole. Okay? You can look at any of these that you want. So this would be the afferent arteriole coming off of the interlobular artery, afferent arteriole. And then we see an arteriole leaving the glomerulus called the efferent arteriole. If we look more up close over here, we get an even closer look. This is the glomerular capsule, the renal corpuscle. So we have the glomerulus, renal capsule or Bowman's capsule, capsular space. All right. Up close here, we can see the afferent arteriole, which brings blood into the glomerulus. Afferent, in this case, it has a little peek-through window. That's how you'll know. Afferent arteriole and efferent arteriole. We're not done yet. We also have collections of blood vessels surrounding the tubules. So if you look at the nephrons, we're going to see a collection of blood vessels around the tubules, where we're going to do tubular secretion, tubular reabsorption. The collection of blood vessels surrounding the cortical nephrons is called peritubular capillaries. The collection of blood vessels surrounding the cortical nephrons are called the peritubular capillaries. The name for the blood vessels that surround the juxtamedullary nephrons would be vasa recta. They look pretty much the same, but they differ in function a bit, so that's why they get a different name. The blood vessels that surround the juxtamedullary nephrons are called vasa recta. Good. I think I'm done with these. Two more things to show you. You might see a model like this. This is the only model that really shows us the ureter as they go down to the bladder, right? Come back a little bit. So we have the ureters. Ureters transport urine from the kidney to the bladder. We see the bladder, and then we see the urethra, okay? Up close, looking at the bladder, you'll be able to see the rugae. So there's rugae or folds, just like in the stomach, to allow for stretch. We're going to be able to see the trigone. So the trigone is a pyramid shape formed by the ureteral orifices. You see these white little balls? They're there to indicate a little opening. The ureteral orifices are the openings where the ureters come into the bladder. It's kind of interesting how this anatomy happens, because the ureter comes down and enters the bladder from below. So the ureters come down behind the bladder and enter from below. So where those ureters are coming down from behind, that little white thing is showing you the opening of where the ureter comes into the bladder. So those are the ureteral orifices, and together with the kind of spouting point into the urethra, it forms a triangular shape called the trigone. We can see the urethral sphincters here, but it's not very well defined as to which is exterior, which is interior. So if I was going to ask you the urethral sphincters, it would be on a picture. Internal is internal urethral sphincter, which is smooth muscle. External urethral sphincter is outside, and it's skeletal muscle. We're not even done yet. Last thing would be some pig kidneys. In the lab, we're going to be dissecting some pig kidneys. You'll be able to see the whole kidney, you'll get to feel what it feels like. We'll be able to see the ureter, kind of a yellow tint to it. We maybe get a chance to see the renal artery or vein. We would know them because, in this case, they inject latex dye. The renal artery would be red or pink, and the renal vein would be blue. Okay? I included this one because you'll see that the yellow stuff is the filtrate. So that means if we're looking at yellow, we think about the pathway for filtrate, which is separate from blood. So we think about minor calyx, major calyx, renal pelvis. On this one, we can see some of the smaller branches. So these are the minor calyces, minor calyx, which feed into a major calyx. And then the renal pelvis would be right here. Oh, I'll come up a little bit. Sorry. Minor calyx, major calyx, and there would be some yellow right here for the renal pelvis. This one does a better job. Just depends sometimes how well they're preserved. This one we get a better look at the renal pelvis. The renal pelvis leads right into the ureter. If we look at this part, we get a look at the, come up here, renal cortex is this region. Renal cortex, more dense. And then from here to here is the renal medulla. I can see, there's only some things you can see on the pig kidneys, okay? So I pointed out on the other one, if you're looking at the yellow, I might ask you the minor calyx or major calyx. I could ask you the renal pelvis as it goes into the ureter. And as we look up close on this one, I could ask you, these are the renal pyramids. Renal pyramids. In between the renal pyramids are the renal columns. The point of each renal pyramid is a papilla. The blood vessels are not so easy to see. We can see, for example, this would be the interlobar vein, but I can just tell you straight up that I'm not going to ask you any of the vessels on the pig kidney because they're hard to see. But what I've covered, you are responsible for. All right, see you next time.